first we're going to talk about what is Sculptra exactly. Why are we having this event? So Sculptra is made of a protein called poly-L-lactic acid, and this is a very cool protein. It's actually been around a super long time. When it first came out, it was used in suture material. So suture material is something you have a cut, you go to the ER, they sew it up. And in that suture material, when they put that PLLA in there, it helped the wound heal faster. So if you've never had any issue with suture material, you're probably not going to have any trouble with PLLA that's in Sculptra. And that's a nice thing about Sculptra is it is bioidentical, meaning the body recognizes it as something natural, and it also only stays in the body for about 4 months. It does its job and then it leaves. And then this product has actually been around a really long time. Sculptra actually was first approved in Europe. Everything good always starts in Europe. And it was about 20 years ago when it was started being used there, and it was actually initially used in HIV patients who had the loss of facial volume, that you guys have all, seen on TV. But then it got FDA approved here for cosmetic use 10 years ago. So it's been around a long time. So what exactly is collagen? I get this question all the time. This is a really cool picture too, and it matches my sweatshirt, so that's why I put it on here. But that is a picture of collagen under the skin. So it is a type of a protein, and it's not just in skin, it's also in bones, muscles, and tendons. And it acts as a support structure. And a good 2/3 of the skin is actually made of collagen, so it's really, really important. And the other thing that we all notice is as we age, we lose collagen. And I'm going to show you some very scary statistics about that. But as we lose collagen, basically that's when we start to notice that our face starts falling, that we start getting more laxity, that we start seeing those fine lines. And so wouldn't it be amazing if there was a way to replace the collagen that we lost? So this is a video. I am unclear if it's actually going to work, but we are going to try it. Let's see. It might not. It's a pretty picture if it doesn't work. Let me try one other thing. Is there a button on there? No. It's probably not going to work. No, okay. That was just a nice picture of the skin. Full thickness picture. So who is a good candidate for Sculptra? So anyone who wants to defy aging. So this is my scary statistic. Collagen production starts to dwindle in our mid-20s and early 30s. And after that, so it could start like at 21. You start losing 1% of your collagen a year. That's crazy. And so, sometimes I will have young patients come in and they'll be like, I'm sorry, but this is what they say. I don't want to look like my mother. So I say, okay, well, these are the things you need to do. They do say that, I'm so sorry. And so, Sculptra could be considered for someone that age. So by the age of 50, by the age of 50, if everything is super good in your life, you stay out of the sun, you don't smoke, you eat healthy, you have no medical problems, you probably lost 30% of your collagen. But if you happen to have any of those other issues, habits, you just have really enjoyed your life, you probably lost half your collagen. So this is where Sculptra comes in, because this is how it works. So Sculptra is kind of like a fertilizer for collagen. That poly-L-lactic acid, wherever it goes in the skin, it creates type 1 collagen. It doesn't create it immediately, it creates it gradually. But then once it's created, it's your own collagen. And it stays there. In the Sculptra studies, the study went for 2.5 years, and the patients that were interviewed, 90% of patients were still happy with their Sculptra at 2.5 years. So the thing is it lasts much longer than 2.5 years, but it's different for everyone depending on extrinsic factors. But type 1 collagen can last 5 to 10 years. So it's something that you're not only replacing what you've lost, but you're also getting something that lasts a long time. compared to things like filler, which I love filler, but filler is definitely something that's going to be great for about a year, and then you're going to think about, oh, I need a little touch-up, and then it's a year and a half, and I need more, and then you aged some more, and then you need even more. So this is something that you can get a lot of your own collagen production and get some lasting results from, because it's natural. So some people ask me if I do one vial, Sculptra comes in a vial, and they let me put that in their face where I think they need it the most. They say, well, how much, what would that be like in terms of filler? So filler comes in a syringe, and typically it looks like I've done 4 to 5 syringes of filler, which some people say, well, that sounds like a lot. But 1 syringe of filler is a blueberry, okay? So we're talking about, you know, a tiny little cup of blueberries here, but you've lost like 25 blueberries. So everybody can use 5 blueberries. And then the other huge question is, well, what if it doesn't work for me? Okay, it's gonna work for everybody. If it looks like it didn't work, it's because it didn't do enough, okay? Because it works on everyone. Okay, so another question, when can I expect to see the results? So the day that we do your procedure, you know, you actually look better when you leave, only because Sculptra is mixed with a form of salt water, saline. And so when I inject it, suddenly everything was lifted and you have now 1 line on your face. But guess what? It's water. And in 2 days, it's gone. And you look exactly the same. So then what happens is magic, because you keep looking in the mirror and you keep looking in the mirror, and then suddenly one day it's just there and you see it. And for most people, it's around 4 to 6 weeks. I would say that definitely can be variable. The younger population, they see results quicker, and in the older population, it might take a little longer, and that's just because of another very sad fact. Okay, so when you are 20 years old, your skin turns over and you make new skin and new collagen every 10 days. Okay, that's why they never look old. But every 10 years you are older, it takes another 10 days to make new skin and to make, almost through this, to make new collagen. So if you do the math, you know, you can kind of give yourself a prediction. When am I going to see the final result of my Sculptra? Well, if you're 50, you know, it might be by taking care of your skin, you wear sunscreen and a hat, and, you know, maybe you've had some microneedling or chemical peels, or you've done some other things to produce collagen in your skin. You know, you may not need that much. So in one session, when I do Sculptra in the office, we just tell patients we're not going to do more than 2 vials. And typically, in most normal faces, it's 1 vial on one side, 1 vial on the other. And sometimes we just do 1 vial because patients want to, you know, dabble. They say, well, you know, I really don't like this. And whatever it is they really don't like, you know, that's what we treat first. When they see a great result, they're like, I want more, okay? So 1 to 2 vials at a session, and typically I say, you know, let's look at it again in 4 to 6 weeks. So we usually wait at least 4 to 6 weeks in between sessions. Okay, I love lips. These are some lips I did last week, and this is why I love filler, because filler is truly an art. And when I do filler, especially lip filler, I feel like an artist. And so it's very, very rewarding and fun. But when I do Sculptra, then I'm like my dad. I'm a farmer. Because literally, I am throwing out the seeds of collagen and growing collagen. So it's fun. It's just not the same. It's not being an artist. Another difference is owning versus renting. So with Sculptra, the collagen that you create, it's your own. And it's going to stay with you for a really long time. When you rent, let's say in comparison, filler is something that is made of hyaluronic acid. It cross-links with your own collagen, but then after about a year or so, it starts to break down. Your body breaks it down. So you're basically just getting that look. You're renting it for a year, and then you got to pay for it again. Okay. And then some patients are marathon patients and some patients are sprint patients. And it's one of the first questions I ask when you come for a new patient consultation. I don't ask you that, do you run marathons or sprints? I just say, you know, are you getting ready for anything? Because a lot of patients come in and they're like, I need a result in 2 weeks. Okay, well that means you are a filler patient, and the marathon patient is going to be the patient, you know, I'm not really getting ready for anything. You know, I just want to start doing something to improve how I look and feel rejuvenated and feel as look as young as I feel. So marathon patients are good for Sculptra. So, and then another nice thing, people are always worried in this field that they're going to be overdone. I promise you I will never let you be overdone. I will tell you no. But Sculptra, I can't overdo you. I can't put too much in. You can't look overdone because it's your own body. And your own body, it just can't overdo you. It's just going to make as much collagen as you need. And you know, I guess I do need to, the reason I put the lips up here is because there are a couple places we can't use Sculptra, and one is in lips, and the other is in the area right under the eyes. I call it a tear trough. It's where, like if you were crying, your tears get stuck. So really close to the eye, I can't use it, and I can't use it in lips. So even if you decided to be a Sculptra patient, I'm not saying you wouldn't ever want to dabble in filler. Maybe you would just need a little filler, you know, to tweak things after you got your own collagen. Or maybe you'd be like, yes, I've always wanted to have lips, you know, that are easier to put lipstick on. So, yeah, and then another thing is just cost. We always talk about cost. And so 1 vial of Sculptra is about the exact same price as 1 syringe of filler. And the filler lasts about a year, and the Sculptra lasts years. So it's actually a great investment. If you ever need something to try to, you know, push your husband, you know, I really want to go have this done, it's a great investment. Investment, that's the key word. So how long can Sculptra last? Well, I've gone over this a couple of times, so I think we got that down. But another interesting statistic is that 94% of patients say their results still look natural 2 years out from their treatment. And you'll understand that more when I show you before and after pictures. Okay, so this is, look how excited I look. I mean, seriously. Oh my God. So I get really excited about doing Sculptra, and so I'm mixing it, I'm getting all ready. But I'm going to tell you kind of what your day is like. So you come to our office.
Oh, whoa.
Don't look. Okay, hold on. Okay, so Scarlett meets you at the door. And Scarlett takes you to your room. No, I'm just kidding.
Scarlett has you sign the papers.
So we take you in a room and we clean your face and we put topical numbing medicine on your face. We have told you prior to try to avoid ibuprofen, Aleve, aspirin, things that thin your blood, or a lot of alcohol. 1 drink's fine. Because those things, because they thin your blood, you're more likely to get a little bruise. And our goal is to try to not have you bruise. So you're gonna have your numbing medicine then put on, which is not needles, it's just topical, it's like a gel. We put it on the areas we're gonna treat. It sits for like 30 minutes. So we say, bring your phone. And then I get to draw on you. I promise I won't write on you, I just draw, okay? So in the second picture, I'm drawing on Tanya some areas where I think that she could use a little more collagen. In the third picture, I'm injecting. So when we have this procedure, there is needles involved, but you can listen to our patients who are here to give testimonials about it. And I did not pay them, but I have a feeling you're going to hear from them that it was fine. And honestly, most patients say it's better than even filler, which in our office, filler is really not painful because of all the things we do. But Sculptra is pretty painless, really, even though it's a needle. So another nice thing about Sculptra is there's really nothing I'm going to tell you you cannot do. You could get a bruise, so I always tell patients bruises take 10 to 14 days for the body to clear, so you just want to plan that. Don't have a major event in the next 2 weeks, because if you do, you will bruise. It's Murphy's Law. Okay, so after the treatment, we just ask you to massage your face for 5 minutes, 5 times a day, for 5 days. That's it. That's all you have to do. You can work out, you can have a facial, you can do whatever you want. Okay, so now we are going to go to our before and after gallery that I previewed already. So this is Sandra. She's 47 years old, and she has had 2 sessions with 4 vials of Sculptra. I don't know if my little pointer thing reached there. No, it doesn't show up there. Anyway, I'll talk you through what I see. So she basically, from the first picture, which is her before, to the second picture, which is her after, overall her mid-face is wider. That is key. So when you look at another person, you have an area in your brain that looks, and if the middle of your face is wider than your lower part of your face, your brain says, that person is pleasing to the eye. It only applies to women, okay? Men, they can be upside down, and they still look fine. But if women have a wider mid-face, it makes them look younger and more pleasing to the eye. So you can definitely see that in the first picture, her or mid-face and her lower face, they're almost the same width. But in the second picture, her mid-face is wider. Her temples are a little more filled in, they're not as hollow. And most importantly, under her eyes looks less hollow and less tired looking, and that's from the collagen stimulation in the anterior cheek. So when you put Sculptra in the anterior cheek, it grows collagen and it forms a convex surface. Might be running out of batteries. And the convex surface, when the light hits, it reflects up under the eye. And so that is an amazing optical illusion of making you look younger and less tired. No concealer needed. And then I would say, you can't see this from this picture because it's more of a frontal view, but I know that she had Sculptra back by her ears, and so she got a little pullback. You know, her skin just looks a little bit tighter in her lower face. Okay, this is Anna. So Anna's 43. She had 6 vials, and these pictures are actually 2 years after her first treatment. So I would tell you for sure, in the second picture, she looks younger than she does in the first picture. And she has a very slight build. Sculptra works great in women who exercise a lot, because when you exercise a lot, you unfortunately, you sacrifice your face for your butt. If you don't exercise a lot, it's not such a problem. But that's okay, because we have Sculptra to fix you. This picture is a 48-year-old, three-ish months after she had 2 vials. So 2 vials, it didn't really take very much, and I feel like she looks much more rested. She also had that big improvement under her eyes. Her overall skin appearance looks better, which is a little hard to see on a big screen, but her skin looks better. And she has definitely kind of a more lifted upward appearance. And then this is Heidi. Heidi had 6 vials, and this is 2 years after her second treatment. Very similar to the first patient, she has that huge improvement in her mid-face. She's lost those tired-looking eyes, and she has some nasolabial folds, which are the lines that go from your nose to your lip. We call them smile lines too. And they look a lot better. You know, even though she's 2 years older, she looks way better 2 years older. Yeah, guys do this too. And guys love Sculptra for many reasons. 1, it's a great investment. Guys love great investments, okay? 2, guys hate maintenance. They don't want to come back every year. They want to see me like every 5 to 10 years. So this guy, 4 vials, he looks much better, and really this is just 4 months later. but it makes a huge difference. Guys tend to need a lot of filler compared to women because their heads are 3 times bigger. And so I always am very excited if a guy wants, Sculptra, just because it's a lot less work for me. And this is another nice man who is 58, and this is a year and a half after 6 files. His big improvements are definitely in those folds that go from his nose to his mouth, under his eyes, and then like his temples and mid-face. His mouth looks different too. I'm not sure why. I think there's improvement in the collagen down under his mouth in the corners. It's called your oral commissures. You start losing collagen there about 30 from talking.